The Healthcare Summit is really the flagship event of the school year for the Healthcare Club and also the program in Healthcare Innovation. It really brings together innovators from a whole range of different fields in healthcare onto the Stanford campus to educate the local community and the students about the important changes ahead in healthcare.
And our goal every year is to have a theme, and around that theme bring in speakers that can talk to us about the leading edge of innovation in healthcare.
The specific subject that it revolves around changes a little bit every year, and what it changes to is what the students are interested in, which is really cool. And it's always around innovation in healthcare.
So this year's summit had the theme of shifting paradigms in healthcare, which I think spoke to all the interesting trends that are underway in the healthcare system in the US in particular, as driven by the recent health reform.
It gives you, an idea about how the thought leaders in the area are thinking about. And that's, I think, very valuable. But it also gives you access to those people. So at networking events, you can walk up to them and talk to them, and everybody is very open to talking to Stanford people.
And it is also a terrific networking opportunity for students to meet with alum and different industry folk and get a sense of really exciting things that are happening in healthcare.
The keynote speech was really great because in a lot of these healthcare conferences you talk about the business, you talk about the FDA and it's so hard, and you talk about regulation and cost cutting and it's so negative. But then the keynote was all about why we do what we do, which is to help people be healthy. And I think it was just the perfect way to wrap it all together.
It is all for patients and making life better for people.
Majority of the sessions are panels, and those panels give a lot of opportunity for students, faculty, professors, all the attendees to really take part in the conversation with people that are really at the forefront of the industry.
I think what I took away from it, big picture, was optimism and the fact that things are starting to change and there's a lot of opportunity out there. And there's a lot of people that are excited about changing what's broken.
I worked on a particular panel looking at how health reform was shifting business models for the different participants in healthcare, including the providers, the payers, and the innovators as well. And so we ran a panel looking at trends and themes related from ACOs to different healthcare delivery models to different payment models within this shifting paradigm.
My interest lies in genetics and genomics, so I was involved in the genomics panel, and we brought in CEOs from startup companies to Fortune 100 companies that are public into our panel, and had a really nice and rich discussion about what's going on right now, but more importantly, what are some of the changes that are coming, and how people, mainly students at Stanford, may that be in medical school or at GSB or other parts, can use these learnings to decide what they can do in the next 5, 10, 15 years to be at the forefront and to be leaders and to lead change in healthcare.
And it received incredibly positive feedback, more so for the same reason all the panels and the summit in general does, is it's an incredibly engaging, interactive day.
It's a day and a half of being immersed in an environment of like-minded people trying to make a difference in the world through healthcare.